Well, Rich, for 3+ years, we have heard lots of talk about Obamacare without a whole lot of knowledge about what it actually does, what it means for you and for our viewers at home. So here's just a snapshot of what the Supreme Court decision yesterday means for you. Inside this Los Angeles ER yesterday, there were two types of emergencies playing out: the patients themselves and the other one, the lifeline paid for by the taxpayer, a staggering number of patients with no insurance.
At its peak, 30 to 40% uninsured.
We were at about 40% uninsured patients.
And who pays for that?
The taxpayer.
Which is why the doctors saving lives here also had an eye trained there on the Supreme Court. And now, because of the court's decision, doctors here believe there will be fewer coming in uninsured. From LA to Milwaukee, and the Rather family watching too. With the plan upheld, soon no insurance company will be allowed to refuse covering someone because they have a pre-existing condition. That new rule's already in effect for children. Daughter Mira, just 6 years old, had a kidney transplant. Her medication costs $2,000 a month, and she'd reached her lifetime limit for coverage.
Did you hear the decision?
Not really.
It was a good one.
After the decision, the insurance company will have to keep paying.
We win on so many levels. We win on the pre-existing. They're not going to look at her and deny her.
And welcome news for mom, too. Women will continue to get free preventative care and mammograms under the health care plan. And by 2014, insurance companies will no longer be able to charge higher premiums for women than for men. From Wisconsin to Washington, D.C., Samantha Ames relieved. She's now covered under her parents' plan, and that will continue.
Wow. There was a very real chance that I was going to lose my health insurance today.
Relief for her, but not in neighboring Virginia, for small business owner George Lozano. By upholding the law, small businesses like his will soon have to provide insurance, and by some estimates, $500 per employee.
I know for a fact it's going to be impacting us very badly.
While back in the ER, a 60-year-old rushed in with a mini stroke. No insurance. The doctor says because of that, no preventative care along the way, no care that could have reduced the chances of this.
Maybe he would not have ended up
Maybe he
here
would not have had the stroke.
and uninsured.
That's correct.
Now, despite the benefits of health care reform, House Republicans have scheduled yet another vote to repeal Obamacare, this set for July 11th. Even if it passes, which it probably will in the House, it's expected dead on arrival in the Senate. And Rich, call it a hunch, I have a feeling President Obama would veto it if it got to his desk.
Yes. All right, let's break this thing down, Andrew. And I can't think of two better guests that we have tonight. And our first guest here, Congresswoman Nita Lowey, no stranger to folks here from our neck of the woods in the Northeast, Democrat from New York. And you have seen quite a bit during your time in Washington, but you must have done a double take like the rest of us when not only did the decision come down, but how the decision came down, with Justice Roberts delivering the majority opinion and actually siding with the four liberals on the court. Surprised, huh?
In fact, a reporter came to talk with me as I was leaving a hearing on the environment, and I didn't even hear the news yet. He got me immediately, and I was so thrilled. And my first reaction, this is a victory for the United States of America. And it restored, for some of us, faith in the Supreme Court. Remember, Citizens United, before that Bush v. Gore. And to have Roberts lead this decision was truly amazing.
Well, it's nice to know that we weren't the only ones surprised when it came down here. Now, Andrew just did a setup piece, and when we're talking, I thought he hit the big points. Seems like a lot of good stuff, and we're going to bring up for you at home here some of the bullet points that this law now, and also as it gets enacted through 2014, right? Some of the other provisions that will take place. Why is this thing still unpopular? Look at the national polls. I know you do it individually, they like it, but as a macro, more people don't like it than like it.
Let me make it very clear for the people viewing this. This is maybe, for some people, very complicated. But let me break it down into the simple facts. It's the same plan that 8 million federal employees have and members of Congress have, which means you set up an exchange so all the insurance companies have to compete against each other. And when members, such as myself, or the federal employees, and now it will be all the people who are going to be part of this exchange. And remember, if you're happy with your insurance, you can keep it. You don't have to be part of the exchange. So what happens at the end of the year, I can change plans, But what's most important is that the insurance companies have to compete against each other. Now, we've talked about this before, Rich. And you know I had many round tables right here in these buildings with large corporations, small corporations, doctors, nurses, dentists, everyone who would be impacted. And for the last 5-10 years, these businesses have had their insurance rates go up and up and up before health care reform. This is what's so important. Before this plan, their insurance rates were going up and up and up.
But in the last 2 years, Congresswoman, you've heard from constituents. You've had the town hall meetings when the thing went through and they say, hey, Congresswoman, I run a small business here. This is killing me. What do you say to them?
What I say to them, first of all, if you have insurance, keep it. They are saying, well, what if I'm above 50? Because below 50,
you're covered.
You're covered. So if it's above 50 and the employer decides they don't want to provide the insurance, there can be an opportunity for all these employees to go to an exchange and buy the insurance. So this is not so complicated. And one of the things I mention over and over again, besides all the good things that you documented very well, is right now, there are too many people who don't have any insurance. And there are seniors who would lose the benefits, the preventive care. This is very important, whether it's mammography or a colonoscopy that they can get. What about someone who has a condition, be it diabetes or celiac or any serious condition? Go try and buy insurance in the marketplace. The insurance company will not take measures to prejudice the plans for them.
I want you to stay with us because since the ruling came out, we learned a few things. Mitt Romney raised a lot of money on the issue and he said, hey, day one, if I get elected here, I'm going to repeal and replace this provision.
Even if though he signed it
right,
when he was
I knew you were going to
governor.
get there. You can't even let me get this out. And the second one is, apparently the White House today sending out directives to lawmakers in the party, hey guys, campaign on this. Go on the attack on this.